Okay, so good day guys. So welcome to Module 4. We are now in overview of health informatics. So from Module 1 guys, we have an introduction or an overview of health information system. Now class, we will delve deeper yan. Explore natin where does this health information system operates. Yan. Kasi class, because the health informatics is the bigger umbrella where your health information system is under. Okay, so let's begin. So what are our objectives for today? So understand the value of data-driven decision-making and its application. So class, we have introduced that health information system is for decision-making. So let's understand it more by exploring it in this module. Next, differentiate the various terminologies under your health informatics. Discuss the application and significance of different health information system, describe the status of health informatics in the Philippines, and to interpret and decipher the information found in your COVID-19 tracker system. So class, what are the terminologies? So let's make it clearer. Let's break it down for you because it can be confusing, guys. So what is health informatics and information technology? Yeah. So class, when we talk about health informatics, it's not only enclosed in your computer programs, yeah, but it contains all methods and systems. So this includes the organization, the people, the culture class for the acquisition, processing, and interpretation of patient data with the help of knowledge from scientific research. Wow. And what else, class? All aspects, yeah, and all aspects. So it's not all about the computer program, but also the people who are involved, their training, the attitude of people, the infrastructure available, all aspects of the generation, handling, communication, storage, retrieval, management, analysis, discovery, and synthesis of data, information, and knowledge in the entire scope of healthcare. So class, imagine how much information that your healthcare system produces. Class, there's so much information, there's so much data. In class, health informatics can assist us with that so that we could understand this data well and use it well for decision making. So class, so it's trying to help us. This is our tool so that we can use all this data for the betterment of healthcare and to improve health outcomes. So management system, all aspects class, sobrang broad ng health informatics. So class, let's just in the slide, and in your module, there is this table wherein they differentiate health information management and health informatics. Right? So when we say health informatics, so this is the broader concept. And under health informatics, we have health information management. So under the umbrella of health informatics, we have health information management. Yan, do you understand, guys? So class, health informatics is the broader concept, yan, and under it is health information management. So when we talk about health informatics, so it's applied IT, so the application of your information technology. So this is a scientific field, so it's very broad, which uses computer technology in the advancement of medicine. Yeah, period. Yeah. So applied IT and healthcare for knowledge, creation, and management. So for the generation of knowledge, for the creation of more knowledge, and for managing healthcare. Yeah. Plus, it's so broad, responsible for design, development, analysis, and utilization of patient and enterprise-wide data. What else? Class, foundation and background in information, infrastructure, architecture, and computer systems. Again, class, it's very broad. So it's applied information technology. It's about data design, programming, information systems. Yeah. But class, Actually, we won't be able to be discussing the informatics portion kasi that's IT eh. But what we're going to discuss in this course are its uses, how will we maximize it in improving the health system. And class, we have your health information management. So under it, class, example is your medical records. So class, your health information management is so simple as compared with your health informatics. Yan. So it manages personal health information in hospital. So example is your medical records or EMR, electronic medical records. Class, it basically deals with your patients and individual related data. So data which comes from your patients, from the health facilities, that is your health information management. So it's very simple. Yeah. So it's about medical records, billing, data regulatory compliance. So make sure that the data of your patients are private and secured. What else? Focus on records management, terminology coding, transcription. Yeah. So it's it's under your health informatics. Yan, diba, class? Simple, simple. And plus, we have other terms, health information technology and health information system. So let's just break it down for you. So health information technology. So your health informatics class utilizes health information technology. So it involves design, development, creation, and use and maintenance of information systems for healthcare industry. We have health information systems. So these are the systems which are which can be bought by the organization, by DOH, by the hospital, by the laboratory. It collects data from health sector and other relevant sector. And it analyzes your data for health-related decision making. So example are your health EMR and LIS. An example of health information systems are your health information management systems. And we will discuss examples of health information systems later. So what is the application of HIS in public health? Isn't it that we discussed that your data, which will be collected by your health information systems, will be utilized by the health planners and decision makers to facilitate better decision making, data-driven decision making, that their decisions will not be based on gut feeling or opinions by their constituents or the opinions of their family members, but based on the current data. So to be able to do that, we need to collect the information that they need. So this 6 will be the overview of their information needs. The data which are required to be collected by the information system so they can decide well. Yan. So, haba na. So, class number 1. So, what are the things that the health information systems collect or the people collect, then will input in the information system? Number 1, health determinants. Yan, health determinants. What are health determinants? So, determinants of health are factors which affects your health. Example, risk factors. Example, lifestyle, the lifestyle of people, the sex, nawala yung ano natin. Yan, nag-overheat na. Okay, sorry for that. Glass yung rin light ko, nag-overheat na. Okay, so health determinants. So what are the factors that affects your health? So your gender, your ethnicity, if a person is smoking, where your occupation class affects your work. So those are the data that they collect. What else? Class contextual environment. So this means that the environment where your health system operates. So example, let's talk about the people who are living in Cavite. So early 2020, so Taal had an eruption, isn't it? So during that time, so it was a disaster, and they used up all their masks during that time, and people were suffering with lung diseases, something like that. So then COVID-19 hits. Yan. And now there is deficiency and scarceness of masks because they already used it during Taal, diba? So ibig sabihin noon, class, during that time, the health system of Cavite was under great strain and pressure because first was Taal and then the COVID-19 hit. So that's the contextual environment where your health system operates. So it can be very difficult. Yeah. Example, class, in Beirut, Lebanon. Yeah. In Beirut, Lebanon, so if you have heard about it, so there was an explosion on their ports because of a chemical. I forgot, is it inorganic phosphate, something like that? It is for this, it's for fertilizers, if I'm not mistaken. So it exploded and it has the explosion had a characteristic of red color. Yeah. So with that happening, the people had a increased distrust of the government in Beirut, Lebanon. So they forced all their political leaders to resign because of that of that circumstance. So, ayun guys, so that is where the health system operates, wherein the people have distrust on their government, something like that. So there is political instability in Beirut. So how could a health system operate in an environment which is something like that? And so there are difficulties depending on the environment. Next class, health service input. Yes. So here in the Philippines, we have limited resources. And since it's already limited, we should account for all of it. Let's account for our facilities. Let's account for the different medicines, vaccines. Let's account for the health workers so that we will prioritize where we will allocate them, where will we place them. Yun. Health information system is also scarce, class. So it's very important that this will all be monitored. Our resources will be monitored so it will be accurately managed. Yeah. So I think you will be hearing some example like NFA rice has expired, something like that. Diba, may mga news na ganon. Like some vaccines or medicines become suddenly expired because they do not monitor the health services input well. Number 3, performance or outputs of the health system. So class, we need to monitor and evaluate how the health system is going. So we need indicators, class. Yeah, next time we will discuss about indicators. So these are the indicators, these are the things that we monitor. Yeah. So to assess if the health system is doing its performance. Yeah. To measure the rate of implementation. What else? Number 4, health outcomes. So to assess the health outcomes, if it's improving or not, we need to measure the mortality, the amount of people who are dying. Yung sabihin ng mortality, we have to analyze morbidity, the number of people who are getting sick of the different diseases, the health status of Filipinos, outbreaks, disability. So class, so recently the census went to our house and asked us how many people are living in the house, our birthday, something like that. So they are monitoring the people who are in the different households. Yeah. Number 5, health inequities in terms of determinants, coverage of use of services, and health outcomes. So to improve health, class, we should analyze the different barriers when it comes to accessibility of health, who are getting sick, are people in this area have access to health facilities, something like that. So next, class, number 6 is the different groups in the society. So the different sex of people, socioeconomic status, ethnic group, geographic location. Class, all these factors affect health. So class, the health information system is actually expensive. Yan, it's actually expensive and we need training to use it. Yan, imagine the amount of data that it needs to process, it needs to collect, it needs to store. Ilang terabyte kaya class yung ano na yan, diba? Ilang memory ang kailangan. So, yan. So, class, these are all the information, are the data that your planners need. Yan. So, class, it's very difficult if you're going to give them directly the data. So, it needs to be summarized, it needs to be processed so that it can be understandable to these decision makers, just like our Senate or Congress. So, the different sources of data. So, it's divided into two. So, institution-based and population-based. So, institution-based are the data that we acquire from facilities or institutions. So, example, individual records, service records, and resource records. So, this can come from hospitals, from schools, and from different clinics. And class, we have population-based. So, population-based, so we're focused on the population yan, to the broader group of people. So we get our data from surveys, from censuses, and civil registration. So class, what is the impact? Yan, let's reiterate it. Let's delve in deeper. Let's add a little more details. Yan. So impact of a good health information system. It brings together all relevant partners to ensure that users of health information have access to reliable, authoritative, usable, understandable, and comparative data. Class, and health information system is able to consolidate, yan, to organize the data coming from DOH, coming from the different agencies, coming from the different health facilities, yan, that it could be very accessible, reliable. Yan. Ganda ng definition ng WHO, which will result to a more responsible and equitable health system. So class, in this course that, you know, we are promoting the use of data. Yan, the use of data, because making use of data, maximizing the use of data can produce a better health system. Yes, that's why class, when I will let you write an essay again, class, I prefer that you would use your references, that you will use statistics and data. Yan, because class, it's more reliable. Yan, I'm sorry, class, because not all opinions are correct. Yan, not all instincts are correct. Yan, your paper should be data-driven. So what else, class? It is useful in policy making and decision making. Yeah, you know that. Why? Because it will be the basis of number one, creating program action. So based from the reports that were given, we can make a new program or improve our program. Number two, translate to efficient resource allocation at the policy level. So we can know where, what facility to prioritize, where should we allocate, where should we distribute our resources. Yan, class, napakaganda ng health information system. Yes. Enhancing quality and improvement of effectiveness of health at the delivery level. So we can improve our health programs. We need a good health information system. Yes. Love it. Now, class, now let's have the real deal. So, health information management in the Philippines. So, let's look at what we're working on. Let's look at the current status of health information management in the Philippines. So, what are the challenges in the HIM in the Philippines? So, according to DOH, class, about DOH, class, they have their quirks. They are definitely not perfect. But what I'm happy about DOH, they are so good at making paperworks, class, with guidelines and standards, class. it's actually complete and it's easily accessible through Google, and I appreciate it about DOH. So I acquired this from DOH. So, they mentioned a couple of challenges in the health information management. So they made a SWOT analysis, SWOT analysis. And these were the challenges or the weaknesses that they were able to find. So there is a challenge on integrating and harmonizing all existing health-related information systems. So imagine, class, in what year your our health system or DOH started collecting data, and it's already 2020. So class, for the last, sabihin natin, 50 years or 20 years, class, so there are so much information that has been collected. And this information are coming from different systems that were bought all throughout the years. So there's a challenge in harmonizing all this health data to make it more understandable. It should be presented in one single system. So coming from different devices, coming from different sources, so there's a difficulty in integrating and merging and harmonizing all this data. Yun yung difficulty niya. What else? Number 2, inadequacy of governance structure on information community technology for the health sector, and inadequacy of governance structure. Actually, class, they are the DOH since 2011. They're actually making a governance structure, yan, but there's still room for improvement. Number 3, lack of plantilla position for system development, maintenance, and technical support. So they need to be hiring more people for information communication technology. Apparently, the data quality is poor, lack of standards on interoperability and data sharing. Class, an example of interoperability is the cloud or Google Drive, wherein anything that you will store in the cloud or in Google Drive, class, whatever device that you will use, you can access it. However, class, that's not the case with POH health information system. There is a lack of interoperability and data sharing. So it's difficult to access it when you are using other device and to data share, yan, because they're not using the cloud or Google Drive, something like that. What else? Number 6, difficulty in reporting timely and relevant information. We touched this in module 1, low utilization of health information. So there still needs to be room for improving the culture of health information use, that Filipinos needs to depend on health information system, and weakness in data analysis. Yan. So opportunities in health information management. So what else can we do? So recognize and adopt EA to enhance ICT in the DOH. So we will discuss EA after. Emerging technologies to automate support business processes, continuing upgrade. So there's the need, so we could class opportunities. So class, we adopted EA already. Class, there are many emerging technologies that are affordable, class, and move towards system harmonization and interoperability. Yan. So class, these are the opportunities that hopefully our DOH will maximize. So class, what is DOH EA or DOH Enterprise Architecture? So this is a branch in DOH. Yan. So wherein they focus on the management of the information that are coming from the health sector. Yan, class. So we can read it. So describe the strategies for aligning business, ICT, and in its infrastructure, class. So in summary, class, so this sector of DOH, So they collect data, store, consolidate. Class, they assess the information needs and share the information needs to other agencies. Yan. So yan yung sector na yan, yung na nagmamanage ng health informatics natin. So class, these are their objective, facilitate the consolidation of the systems, promote, ito na naman tayo, interoperability, coordination, the reference, so they will set the standard for the developing your information system. So they will allow the increase of accountability and ownership to make sure our data is secure, secured, harmonized, and optimized processes, yan, to make it easier to be integrated in the healthcare, promote the use of standards. Yan. So standards which are given by DOH or standards which are recommended by your WHO, something like that. Yan. And class, DOH, EA is the sector. E-health in the Philippines class is the, I think, is the government structure for handling your DOH-EA. Yan. So your your e-health in the Philippines class improve the flow of information through electronic means to support and facilitate delivery of quality and responsive health services and better management of health systems. So they improve the flow of information. So class, DOHEA is the broader sector, and under it, we have e-health. Okay. So by 2020, its vision is to enable widespread access to healthcare services, health information, and securely share and exchange clients' information in support to a safer, quality healthcare, more equitable and responsive health system for all Filipino by transforming the way information is used to plan, manage, deliver, and monitor services. Class, their vision is so good. It's 2020. So this, I think this document is from 2011. And hopefully they're still striving to achieve such a vision and transform the way information is used. So class, as we end in this module, I hope with health information system subject, it will transform the way you use information. Yan. We can maximize it to its full potential. Yan. So good. And so class, finally, so these are your sample health information systems in the Philippines. Yan. Please read this in your module para hindi na mapahaba yung discussion natin. Please read. I only just gave 6. Yan. Please go over this. So we have HOMIS. So HOMIS is used in government hospitals. Example is BGH. They use HOMIS. Hospital Operations and Management Information System. So class, your laboratory utilizes HOMIS because it's under the government hospital. Another example is sheets. Yan, sheets is usually used as a population-based information system. So these are used in your LGUs, in your rural health units. We have COVID-19 tracker. So I hope you will visit the site of your COVID-19 tracker. Class, explore what is inside your COVID-19 tracker. This will be all in your quiz. So class, thank you for listening. I appreciate you taking the time to listen in this video lecture. I hope you learned a lot. Have a great day. Okay.